Hi, my name is Christian Saint-Pierre. I'm a registered acupuncturist at Access Acupuncture in Dartmouth, Nova Scotia, a certified balanced method practitioner, which is an advanced system of acupuncture from Taiwan, and a faculty member of the Academy of Acupuncture in San Diego, California. Today, I wanted to share with you an interesting case about how acupuncture helped a man get pain relief for his knee pain. So, acupuncture works really well for all kinds of joint pain, whether it's large joints like shoulders, knees, hips, or whether it's small fingers, toes due to arthritis or injury. It can help with chronic injuries, it can help heal or speed up recovery for recent injuries, and it can help with various kinds of arthritis as well, and tendinitis. In this particular case, we were treating a gentleman who had a history of knee pain due to a bit of a freak accident, actually. It was a man in his 40s, and he was working in his yard. He was unloading his flatbed truck, and so he was standing in the flatbed, and what he had done is he had basically picked up some heavy, probably soil bags. He was doing some gardening. These were big bags of heavy material, and what he did was, rather than hand them off, he jumped down off of the flatbed truck. And when he landed, the impact really injured his knees. There was compression, there was a little bit of torque on his knees as well, and so he actually ended up unable to walk for about a week while the knees healed. But he ended up with chronic knee pain after that. And so when I first saw him, he had had knee pain for over 10 years. Now, it wasn't to the point where he couldn't walk, but he could definitely not stand for long periods of time, and any kind of sporting activities, whether it be running or rollerblading or skiing or any kind of activity like that, he just couldn't do, let alone squatting down. He could very barely do a squat, and it was very painful for him. So when I first saw him, actually, it was during a demonstration. So he was actually, he came by our booth, and he asked about acupuncture and what it could do, and he explained that he had knee pain. So very quickly, I put just 3 needles in, and they didn't go in the knees. They went actually in around his elbows, and within a minute, he was noticeably feeling relief, and so he started walking around and doing squats, and you could see the amazement on his face because he hadn't had that kind of relief in over 10 years. So we left the needles in a little bit longer. I stimulated them, and by the end of the session, he was actually running back and forth in front of our booth. He was absolutely flabbergasted and amazed, and so it's always one of the more pleasant sort of situations when you can provide that level of relief that quickly, and have the person demonstrate something that they weren't able to do, for the last 10 years. So. Now, one treatment provided amazing relief, but of course we needed to do a session of treatments because we wanted that pain to stay away. The pain was due to obviously inflammation, circulatory obstruction, and there was a lot of tension in the knees because he'd been basically protecting his knees for such a long time, so we had to get rid of all of those things. And because his body was so used to holding that sort of pain and that tension, it did take a little while to retrain the body to actually get that knee pain completely gone. But he came in for a course of 10 sessions, twice a week, and even by the end of the second week, so by his 4th treatment, or his 5th treatment if we include his first treatment, then he was reporting that he was spending most of the week pain-free, and was able to actually engage in some activities that he hadn't been able to previously. For instance, he had gone snowshoeing, and he had done some light jogging, and he had played a little bit of basketball at home with his kids, which was something he hadn't been able to do in years. So he was thrilled at that. And so we continued with the treatments, and by the 8th treatment, actually, I suggested that rather than seeing him again twice a week or 2 times the next week, I said let's wait a couple of weeks, and I'll see you once in 2 weeks. And so when I came in 2 weeks later, he had no pain. So then what I said is, okay, let's see you in 4 weeks. And when he came in 4 weeks later, he still had no pain. So that's the kind of progression we want to see. We want to see people who, when they're getting their treatment, they're getting good relief, which acupuncture, especially balance method, can absolutely do. And then when we start to see that the treatment is holding, in other words, they're coming back for their next session and the pain is still gone or much, much, much less, then what we start to do is we start to extend the time between treatments. And when we can see someone basically a month later and they still have the relief that they experienced from the acupuncture, that usually means that the body has retrained itself and is now holding that new condition, that new state. The pain is gone, the tension is gone, the circulation has improved, the inflammation is down, and it's staying down. So at that point, it was just a question of maintenance. I said, okay, I want to see you once a month for the next 3 months, so a season basically. And he had no limits in terms of what he was allowed to do, so he was allowed to do anything that he wanted to, with the understanding that if the pain came back, he should come into clinic right away so that we can actually treat the problem as soon as possible. So that's what he did. He did come in once, just sort of because he had overdone it a little bit. He'd been on a long run, and then he had gone and played soccer, and then he had gone swimming, and so his knees were quite sore, but not sore from injury, just sore from usage. So we did an acupuncture treatment just to calm that down, and then after 3 months of seeing him once a month, basically he was discharged, right? He graduated from his pain, and I said, just come in whenever you need to. So that's how acupuncture can help knee pain. And it doesn't really matter if it was inflammation or injury or bone degeneration. The way that acupuncture works is it can essentially reset the conditions of the joint so that it can start to heal itself again. Now, this was a case of treating knee pain, but as I mentioned earlier, acupuncture works very well for all joints, whether it's tendinitis of the elbow, whether it's the neck, the spine, whether it's the ankles due to sprains. So there are so many joints in the body, and acupuncture can absolutely have both pain relieving as well as a healing effect on all of those joints. So if you'd like to learn more, or if you'd like to book an appointment, you can visit accessacupuncture.ca or give us a call at 902-999-4325. We're open 7 days a week, and we'd be happy to help you. Have a great day.